What would you do if your bosses suddenly announced the job you had held for decades would be outsourced to another company? For up to 400 Eastern Health cleaners, orderlies, patient service assistants, and food service staff across a number of Eastern Health's locations, including Box Hill, Maroondah and Blackburn, this could be their new reality. On Tuesday morning, I went along to the Health Workers Union meeting outside Box Hill Hospital. Union lead organiser Jake McGuinness addressed the crowd of about 50 workers.
Your jobs are going to be privatised. That's the state of play at the moment. I think we can all speak honestly here and say that the consultation is a sham. In COVID, you were essential workers. But now, on this rather grey and slightly rainy morning, to them, you're expendable.
The union reckons this move actually breaks the current enterprise agreement, which is supposed to guarantee secure jobs. And if the outsourcing goes ahead, it says workers wouldn't be able to take industrial action or properly bargain.
The labour hire firms tend to copy in spirit the agreements that are signed by the public sector with some weakened conditions.
The union's now calling on the Victorian government to step in, but so far there's been only silence. An Eastern Health spokesperson told me there has been no final decision made yet, and they're still consulting with staff and industrial partners. I spoke with Greg, who's been a patient services assistant with Eastern Health for 36 years, and says he and his colleagues feel like they're being tossed aside in the negotiations.
It makes you feel undervalued. We worked through COVID. We've had to deal with a lot of stressful issues, during that time, and you just feel forgotten as a PSA. And the fact is, you feel like you're disposable. You feel as though Eastern Health, as I said, they don't value you, that they're just going to toss you aside to a multinational corporation.
So what do you think? If Eastern Health is a public health service, should these jobs be kept public?